The number of health workers infected with the coronavirus in Nigeria keeps rising as the country battles to halt the spread of the virus. All over the world, there are complaints of insufficient provision of personal protective equipment for frontline workers, and the story is not any different here. Now, health workers in both public and private centers have been lamenting the lack of hazmat suits and face shields, gloves and other protective gears that would limit their chances of contracting the virus while attending to infected persons. Joining me now on Skype is Chinwendu Anago Amanze, a public and family health nurse and health education manager, and under Morgan Universal Relief Team in the Southeast. It's nice to have you join me right now, Chinwendu. Now, make us understand, it is quite scary to see that the number of infected health workers is increasing by the day, and the alarm is being set out on daily basis. What can anyone do right now? The government or even the enemy or even the public health workers themselves who are engaging with the people?
Okay, good morning. Thank you so much. Lots of things can be done. Lots of things can be done. Let's start with the border. Our interstate border, yes, it has been declared that we should lock it up and reduce movements. But the truth is that most people still find themselves into the border. They come in, they are being allowed in. And then secondly, our most of our people don't really believe that the virus is real. They don't believe that at all. Most of them just doubt and they keep doubting. So, number one, our government should help us to tighten the border. There are ways by which people, they know the borders. The people in that area know the borders. Then we have people, the public health practitioners, who can go in, just like what you people are doing also, to sensitize the public so that they can comply with the use of the mask. Many countries have gone through this. Taiwan, Czech Republic, these countries, most of them made use of their nose mask. So you will see people who will wear their nose masks, but they will use it as a necklace instead of using it on their nostrils. So proper use of masks is also very important. Some days ago, I was watching a bank and the bank was overpopulated. Most persons were kept outside and you are expected to come in 10-10. Those people who are allowed to stay outside, more than 50 to 80 persons, they can infect themselves before they move into the bank. So if our government can help us with the border, and then the banks can help us as public places. Another one for public places is the markets. You can't protect yourself in the house, and then when you go out to the market is crowded. This is a pandemic. So what I would advise is the marketplaces, if you watch other countries, there are lines, there are demarcations they do on the ground so that individuals are very careful, so that you just know this is where I should be. This community or this compound goes to the market, because if you say Monday everybody should go to the market will be rowdy.
All right.
So,
Chinwendu, at this time, what should be the first precautionary measure that public health workers should be looking at or imbibing as they engage with people? Because the symptoms seem the same for all kinds of illnesses right now.
Okay. Basically, as you said, it's kind of the same if you don't really understand. But there is something about difficulty in breathing. Fever is common. But in some countries, what they do is this. They do house-to-house testing. Some people may not accept this. And they may say it's not possible in Nigeria. But do you know that during election, everyone can vote through our polling units? So if we think of this, if they do house-to-house testing, and then they discover a sign and symptom, Then you go to the flu clinic, or you go to a designated health center, health facility, or a hospital. On getting there, those people may now have a specific test. Most persons are scared of, being quarantined in a place and so. If you health educate them properly on self-isolations in your home, some countries are doing that. Self-isolation in your home, except you stay in a one-room bedroom, self-contained or something. But if you have a space, or there's a way you can glorify the name and tell them it's a quarantine hostel or something, and then you take good care of them. You discover that some of our I've seen videos, pictures of our quarantine centers. They are scary. So as a public health practitioner, we ought to be in the field. During the 1918 flu pandemic, health workers, public health workers, were seen going house to house, because when you are in the community, there's surveillance. But what we have now is that people who are not even trained in health, not to talk about public health, are all in the field.
All right.
What we are doing now, okay?
All right, we have to leave you here now. Chinwendu Anago-Amanze, thank you so much for your enlightenment there. And certainly we look forward to all of them being implemented and taken very seriously. Thank you very much for your time on the program this morning.